Many have their doubts about this new therapy for two appropriate reasons. This treatment has proven to be unreliable, and many also have issues with the possible misuse of this treatment. Although those who do not agree with gene therapy have valid reasoning, with regulation and continuous research, I believe this new breakthrough in medicine will help the genetic burdens that millions of families deal with all the time. First, we will go over the reliability issue. Dr. Hoffman explains that sometimes a corrective gene lands in the middle of a functioning gene and disrupts its activity, which may be why many treatments have caused the worst outcomes. For example, a 4-year-old girl who happened to be the first to take place in a gene therapy clinical trial back in 1990 was diagnosed with combined immune deficiency. She was injected with correcting genes found within the uroleukemia virus in order to boost her immune system. Unfortunately, the treatment didn't work. Also, an 18-year-old in 1999 who inherited carboxylase disorder went through with a gene therapy treatment. He died 4 days later from organ failure. The FDA determined later that the boy should have never been put on trial due to the high levels of ammonia in his system. In 2002, 2 girls were put on trial to treat severe combined immune deficiency. Afterwards, they were both diagnosed with leukemia. In 2007, a lady took part in a clinical trial to treat active inflammatory arthritis. She also died. Inder Verma, a specialist in gene therapy at the Salk Institution in La Jolla, California, explains that we're lacking a reliable method for directing a corrective gene to a specific site on a chromosome. Fortunately, scientists have become better at this technique. This treatment is thankfully becoming much more dependable. Some examples include 12 children and young adults were in a gene therapy trial to treat severe blindness. The doctors did the treatment on each patient in one eye. Every patient afterwards benefited from the treatment. Scientists are currently doing research to find out if the kids will benefit with a second treatment in the opposite eye. These kids could potentially have full sight again. What a miracle. The test has proven successful for people who suffer from chronic wounds. This therapy works by stimulating mesenchymal cells by specific signals. These signals allow the cells to be released from the bone marrow into circulation. They then can arrive at their target tissues where they undergo in situ differentiation and then contribute to tissue regeneration and homeostasis. Gene therapy has also led to the HIV vaccination. Women will no longer have to worry about getting HIV and cervical cancer. Researchers at the University of Buffalo have potentially found ways to defeat the flu and other viruses. People will no longer need to suffer for a day or 2 at a time from these awful viruses. If these tests continue to be successful, this new advancement in medicine will be more efficient and cost-effective. Now we are on to the ethical issues. The 2 main concerns include gene doping in sports and the possibility of designer babies in the future. Gene doping is when athletes use drugs that are normal use for patients who have serious health conditions to improve their personal athletic performance. One drug, for example, helps to increase blood production in patients. It also helps the athlete's endurance. Other drugs help to improve muscle growth and contraction, endurance, blood production, pain perception, and oxygen delivery, all of which will also help these athletes' performance. Unfortunately, these athletes don't understand the implications that come along with gene doping. One scientist points out that those who try it are more likely to do harm than to provide any athletic advantage. Gene doping is currently illegal. However, tennis stopped one Chinese scientist from offering genetic manipulation to help athletes before the 2008 Olympic Games in Beijing.